Thank you very much, and good morning. Morning to everyone. This presentation is really a reporting on a conference which was held in 2018. It's a dialogue between religious leaders and members of key population. And we've subtitled it the Dialogue for Transformation, because we are of the view that it is by engaging each other in meaningful and fruitful dialogue that we will meaningfully engage and transform the present landscape that is before us, and therefore advance an environment of respect for each other. The presentation focuses on basically three areas, and the project that gave expression to this conference is really focusing on training religious leadership to become sensitive to the present environment. Next slide. Establishing partnerships so as to broaden the dialogue. So it's not religious leaders talking among themselves, but we are including advocacy partners, etc., and developing appropriate training material for religious leaders, because one of the things we are mindful of is that a number of our religious leaders who are very prominent, they are bishops and imams, etc., they had very little or no theological training. It took me, for example, 7 years for training before I was ordained a deacon. Many of the religious leaders we are contending with these days have very little training. They wake up one morning and they got a vision to say they should be leading a movement, and they started in that way. So we're not at the same place when it comes to intellectual pastoral engagement. Next slide. So by way of partnerships, we are very grateful, and we're grateful to the AIDS Healthcare Foundation and the Pan-Caribbean Partnership in the Caribbean, PANCAP, for sponsorship for that conference that was held in 2018. Next slide. So the presentation, as I said, is essentially reporting on that consultation back in 2018. Next slide. Here we see a picture of Dr. Eddie Green, who I know is in on this consultation, and a representative of the funders. So PANCAP is here, and of course I am there as one of the lead, and the Jamaica Council of Churches as a key partner in the consultation. The European Union, represented by the young lady between Dr. Green and myself, was also present. Next slide. So as I said, it's a dialogue for transformation. The theme of that consultation was harmony and sustainability of partnerships to achieve the end of AIDS as a public health threat. By 2030, it was held between November 27 and 29 at the Cardiff Hotel in Runaway Bay, St. Anne. Next slide. The process of the dialogue involved a leadership team, and as you saw, Dr. Green, myself, Dr. Lise Dunn, and others led the team based on partnership principles between representatives of key populations and religious leaders. There were 2 facilitators, a team of 3 rapporteurs from the University of the West Indies Institute for Gender and Development Studies, the Mona unit, a resident psychologist for support, providing psychological support for participants during the consultation. And the leadership team met at the end of each day to review the processes and the plan for the next day. Next slide. Key principles were agreed on by religious leaders and key populations and blended so as to provide the overall guidance for the consultation. The rapporteurs and the facilitators allowed for discussion around 4 questions, and responses to these questions were compiled at the end of the consultation. Next slide rather. The first question that guided the discussion: what are the gaps that you have encountered in your work in the treatment and prevention of HIV, and what are your recommendations to religious leaders and key populations for jointly addressing these gaps? The second question: what are the determinants of stigma and discrimination? What is required by the partnership between religious leaders and key populations to break down these barriers? Next slide. The third question: what is the nature of the partnership required between religious leaders, representatives of LGBTI, and parliamentarians that would foster a positive legislative environment in the Caribbean, addressing human dignity and social justice? Next slide. And the fourth question: in what ways can members of key population and religious leaders demonstrate an appreciation of each other's position and yet continue to engage in constructive dialogue with each other as a prerequisite for increasing access to public health? This suggests that the dialogue anticipates that there will be differences of views and opinions, but that we can work together for the sake of public health and human dignity. Next slide. Day 1 of the conference started with a dedicated time for religious leaders and key populations to meet separately, to share their thoughts and feelings, and to organize themselves in such a way as to be able to have a unified voice in the larger plenary. Following those separate conversations, we had a joint opening of the conference with messages by Dr. myself, convener of the Regional Religious Groups Steering Committee. Then, next slide. On day 2 of the consultation, religious leaders shared their experiences of advocacy in the church and other religious spaces, advocating for HIV and AIDS, and what they have done and continue to do in working with key populations. Following this sharing, there was a panel discussion in which key population representatives shared their own stories and experiences and perspectives. Religious leaders responded to the stories by representatives of key population, addressing issues of stigma and discrimination against key populations, and how faith-based groups could better mitigate negative experiences of key populations. Next slide rather. From the dialogue, and I don't have time to go into the details of it, but just to say that one of the stories coming out of the dialogue from a member of the key population was graphically describing how he was shot 6 times in Kingston by a licensed firearm holder, indicating that his aim was to kill at least 6 people, 6 homosexuals. There are other graphic stories told. Coming out of that was some recommendations, as I said. Next slide. So first of all, the participants indicated that there were some gaps which were identified, and there must be steps taken to address those gaps. One of them is increased education and training programs to address lack of information, improve levels of confidentiality, especially among healthcare workers and people in the faith-based organizations, reduce the risk of ear shopping, where people go into clinics to put themselves into earshot where key population were persons and HIV positive people were being interviewed so as to come and spread information about them. Next slide. There was also a recommendation to address issues driving stigma and discrimination, which include ignorance, fear, dogma, and religious doctrine, and increasing the visibility of HIV positive persons in the response, particularly for those who are using ARVs and are living healthy. Next slide. We focus on increased sensitization programs to help families to understand sexual diversity and HIV and enable them to create support systems for key populations, promoting the right to health care and accessibility to affordable medicines, and promoting advocacy on test, treat, and defeat. Next slide. Recommendation includes supporting advocacy for sanctions to end stigma and discrimination in religious organizations, as well as health and other sectors, to close the gap between policies and practices where policy commitments on human rights and sustainable development are juxtaposed against social norms and institutional practices that perpetuate discrimination and increase risks of HIV infection and human rights and well-being for key population. Next slide. The conference concluded with a commitment to organize similar fora between religious leaders and key population in various areas of Jamaica in the short term and in the medium term, and includes follow-up with religious leaders, key population dialogue, and each participant making a commitment to take action and promote dialogue to end stigma and discrimination. Next slide. I want to end this presentation with a quote from one of the participants. The participant says, "The churches have strengths, they have credibility, they are grounded in communities. This offers them the opportunity to make a real difference in combating HIV and AIDS. To respond to this challenge, the churches must be transformed in the face of HIV and AIDS crisis in order that they may become a force for transformation, bringing healing, hope, and accompaniment in all affected HIV and AIDS, and accompanying all those who are affected by HIV and AIDS." Thank you very much for your time. God bless you.
Thank you very much, Canon Garth, for that. It was very enlightening, and it's wonderful to know that things are happening in Jamaica. One of the things that struck me, this is to Maurice, over the past weeks, are the wonderful newspaper reports and articles that you've put up on Anglicans for Decriminalization, the Facebook page. Mind-boggling at times, and some of the articles very brilliant indeed. So thank you, Canon, for that, and we hope you'll stay for the question and answer at the end. Our next speaker is Professor George Garwood, who is a professor of world religions. Welcome, Professor George.